My name is Bobby Lynn Kekik, and I'm the Director for New Student Programs. I'm so glad to be here with you all this evening and want to officially welcome you to our Falcon live chat on student well-being. We are recording this session, so you'll be able to review this at a later date. And for those of you who are viewing it as a pre-recorded session, we will have some information as to how to contact us. So please feel free to reach out to us if there are any questions that are left after you review this content. So without further ado, just a few housekeeping tips. There is a Q&A button at the bottom of your screen throughout the presentation. If you have any questions that come to mind, please feel free to go ahead and put your questions there, and we will address them at the end. We did have some questions that were submitted beforehand, so we are going to infuse those as much as possible, but please do not hesitate to ask us any questions. And if we're able to answer them, we will gladly do so. So without further ado, we're going to go ahead and shift to some introductions from my fabulous colleagues. Then we'll get into some content, and then we will finish up with some questions.
Hello, I'm Dr. Anjali Vermani. Welcome to today's live chat. I've been looking forward to speaking with you. I am also the Associate Dean of Health, Wellness, and Counseling and the Medical Director of the Health Center.
Hey everybody, welcome to the chat. My name is Dr. Peter Forkner, and I'm the Director of the Counseling Center at Bentley, in sort of charge of all your mental health needs.
Hello everyone, I'm Jessica Guerrero-Trawa. I'm the Director of Wellness and Prevention here on campus. Welcome.
Hi, so I'm going to get started, and I'll be going through some of our traditional orientation materials today, but I'm also going to pause and speak to you directly about our COVID-19 response, our planning, and return to campus planning. So there may be some things that I won't cover, and that's because those are from other areas. So I will refer you to other areas on campus. They could be housing, campus spaces, campus events. So there's a lot of people working on this return to campus. And so, please feel free to reach out to those resources as well. So just to bring you back into what our usual practice is, our group has 3 offices and 1 mission. We collaborate together on a regular basis. We have our health center, our counseling center, and our wellness center. And so we are really committed to high quality care. And that has been our mission for years and years, and that will not change. We provide direct clinical services, psychological services, and prevention. So the health center is located at Rhodes Hall, which is a dormitory on campus in the center of campus, and that's across from the student center. And that's going to be the home base of where the healthcare will occur for the students. But we will be utilizing other spaces on campus as well. So this practice still remains the same in terms of the fact that there is no charge for students enrolled at Bentley for office visits provided through the health center. And that's available for all full-time students, and that's regardless of your health insurance. What we'll be doing is we'll be scheduling appointments for students over the phone, and so that we can give you the best type of care given the current COVID-19 environment. We will also be adjusting our care to add additional modalities, and that includes telehealth, in-person care, and telephone-based care. We also partner with University Police for after-hours care, and they are our partners. Their phone number is listed here. Of course, it will be available to you when you come on campus. And our team consists of 5 nurse practitioners, myself as a physician, a registered nurse who's our vaccine coordinator. We also treat multiple injuries, preventive health, and other, acute care. We will be focused a little bit more on COVID-19 related care in the upcoming semester. And again, things will look a little different, and we are planning to be very flexible with that. We also provide health education that is built into our office visits, and also connecting through counseling and wellness while we do that. Laboratory tests are sent out to local laboratories for blood testing. We administer immunizations, we write prescriptions, and then we can refer to our local community partners. We work with Newton Wellesley Hospital as a good partner for us for urgent care and emergency room care and inpatient care. So important to note, when you come to college, services in the health center are confidential. Because most of our students are 18 and over, this applies to them, where the services provided will not be discussed with any other person, including family members, unless there's written permission or it's appropriate to do so due to a medical or life-threatening emergency. However, given the COVID-19 environment, we are asking that you keep emergency contact information up to date, because we do want to communicate with your family if that is appropriate for you and should be, done in that particular environment. So we reviewed some of these things already. Prescriptions are covered by your health insurance. The office visits, again, are no charge. Immunizations are also typically covered by your health insurance. Laboratory tests are covered by your health insurance. And our hours are Monday through Friday, 8:30 a.m. to 4:30 p.m. And after hours, as I noted before, University Police is our partner, and they respond to emergencies and help coordinate transportation. We do, again, have excellent local hospitals. This includes Newton Wellesley Hospital as well as Mount Auburn Hospital. And there's an urgent care very close to campus, as noted on the slide. So student health insurance is an important topic. It's important to understand that Massachusetts requires health insurance for every person living in Massachusetts, and that includes students who are coming to campus. So if a student feels that their insurance is based out of state, it's really important to consider getting the student health insurance plan. We have an excellent plan. It's a Blue Cross product, and it provides excellent service, especially locally within Massachusetts. It's very important to think about this in our current environment, and our international students are required to enroll in this plan because it is most protective for their health. So this particular product, we partner with a group called University Health Plans that is on our website with more information, and you can reach out to them if you have any questions regarding coverage. The basics are covered here. I feel it's an excellent plan. The price is very reasonable relative to other colleges, and we do price out what is reasonable when the prices are set every year or so. And there's additional insurances available if that's appropriate for you. That could be dental, vision, or even tuition insurance. So that, again, is on the website. So please check those resources. So immunizations, there are immunizations required to come to campus, and certainly you've had outreach probably from my nurse, who's our vaccine coordinator, and she will make sure that all of these are entered right into our health portal. And these are the particularly important vaccinations that we'll require. Now, given this COVID-19 environment, it's even more important than ever to protect yourself against any infectious diseases, and these are really important. I also want to pause for a moment about the meningitis vaccine. It's also listed as meningococcal. So there is this option to have a waiver, and I really want people to consider not having that waiver and to go ahead and get the vaccine. And the reason is meningitis is typically spread more in a residence hall than any other environment. Cohabitating environments is where meningitis spreads. That's why it's recommended for first-year students, and you should really consider having this protection. Meningitis is a life-threatening condition, and certainly we want to protect you and your health. All right, so we have an excellent health portal. This is linked through the website as well as the link that's listed there. And it's important, and the first encounter you'll have with this portal is when you enter your vaccines. That's going to have the date and the type of vaccine, and it's not difficult to enter those, but feel free to reach out to us if you have any questions about that. We also have a tuberculosis screening form. And so when you interact with the portal for the first time, take a moment, read the directions there, and let us know if you have any questions. I have a couple of samples here of what the portal looks like, just to give you some familiarity. There are even more clear instructions now than when this slide was made, so please do take a look at the portal. Later on, after you've completed this and you're a student on campus, you're going to be able to utilize this portal to get test results, to communicate with the health center, and it's our secure way of communicating with patients. So again, student immunizations, it's going to look a little different in the fall. Typically, we do a catch-up immunization clinic on the move-in, but because of all the restrictions around COVID-19 and the need for personal protective equipment by healthcare personnel, we may be recommending you go to our partner pharmacy. They are located near campus, or certainly if you are in the United States, please see a local pharmacy if your own personal physician can't get you caught up on all your vaccinations. So let's get into some COVID-related situations here. I wanted to pause for a moment and just recognize how difficult this time is for students. I myself have 2 college-age students at home, and I just want to, take a moment to appreciate how difficult this is for the transition, whether you're a first year, a transfer, or a returning student. I just want to, let you know that we realize this is a difficult time. However, we're doing our best to bring you back to campus, and we're going to do that as safely as possible. And so there are some requirements, and unfortunately it will feel like restrictions, but they're going to be there to protect you, to protect your campus, your roommates, and your family ultimately. So new to the COVID updates is travel requirements for Massachusetts. So that guidance is going to be clarified with Dean Shepherdson later this week. He will issue guidance directly to students as to how Bentley students should follow these requirements. They include some options. You can have a test at home. You can have a quarantine for 14 days before you participate on on-campus activities, or there could be a test in Massachusetts with the quarantine in the waiting period. So Bentley leadership is determining the best way to handle this situation, and I know there's going to be a lot of questions. That's completely understandable, but this just came out on Friday, so it's evolving. However, we have put some other things in place, and I think they'll be very protective for our campus. There's going to be a Bentley screening test. What is that test? That test is a diagnostic test. It's a PCR test, and it's done with an institute called the Broad Institute, located in Cambridge, Massachusetts, a very reputable institution that has created a really highly accurate PCR test. The way the test will be done as of this time is that the student themselves or the other people on campus, including faculty and staff, will participate, will be doing a self-swab, and they'll be instructed as to how to do this simple procedure. It's as simple as taking a Q-tip-like swab, dry, putting it at the front of the nose and just swabbing around per the instructions of our coordinator. It will take approximately 30 seconds to a minute to administer that. You put it into a tube, and then we'll be able to process that and get test results back to you within 1 to 2 days. So that will be done on entry and then weekly thereafter. So that is a unique program to the Boston area, and other colleges in the Boston area are going to participate in this test as well. So there's a whole process. You'll get more information, but overall, that is to find people who don't have symptoms of the illness and remove them from the rest of the population to prevent the spread of the illness. And they'll also be taken care of if they were found to be ill. So the other piece, daily self-screening. So this is pretty standard for any of you who had any work this summer or family members who've gone back to work this summer. Everybody screens for symptoms that they may have in the morning before they leave their dormitory or before they return to campus. Do they have a fever and many other symptoms? We'll give you the checklist and we'll assist you on what to do if there's a problem. If you note any symptoms, if you have any concerns and you're a student, you should call the health center and we'll give you guidance. So it's really important to do that every day. Diagnostic testing is separate from screening testing, and that will be a very similar test to the one I just described. The difference is that's for when you're sick. If you're sick, then we got to find out what's going on. That's when we do the diagnostic test, okay? Contact tracing and isolation quarantine, these are big questions. And again, this piece is also evolving. So I may not be able to answer all your questions about quarantine and isolation, but I will tell you what contact tracing is. And that is finding if somebody's sick, who were they with within the last 2 days, That's about more than 15 minutes and within 6 feet. So if you're following the guidance of staying 6 feet away and wearing a mask and you're in that person's presence for less than 15 minutes, you're not a close contact. So, always keep that in mind while you're moving through campus about who you're with, because that group will be your contact. Sometimes you can't avoid it. Could be a roommate. Sometimes you can't. So keep that in mind as you move through campus. So for medical conditions, I just want to reach out to you as a physician myself that students who have medical conditions should really sit down with their primary care doctor, their specialist, or their healthcare provider and talk about the option of remote learning. This option is available to all students who don't need any special accommodation to make the choice to do remote learning and or living in your family home. That is definitely an option. If students have medical concerns that put them at risk for infectious illnesses, I would be particularly concerned about them living in a campus environment. And I think that risk should be discussed with your physician. So that could include conditions like asthma that could affect the respiratory system, diabetes, which has an effect on the immune system, and then also conditions where you take medications that could then suppress your immune system. So if those are applying to you, have that conversation, reach out to our office if you have any questions, and we're happy to guide you. But again, no special requirements are required if you want to learn from home. And you can also register with disability services if you needed to, and that's if you need an academic accommodation. And that would be somebody who needs additional time for testing or needs to notify a faculty about something that is ongoing for them. There are also some other updates that we have. So we have some special safe workflows. We're going to use Spaces on Campus to evaluate students in examination rooms that have special ventilation. So all these processes are still in, working out, but we'll be assured that they're very safe. So again, a lot of resources are available in the Back to Bentley website, and we are trying to update those regularly. As new guidance comes out, sometimes I take a pause because we need to process that and then post it, but be assured that we're well aware of it. And if you have a question, again, feel free to email us in the meantime. The other information is right here. University Health Plan's a great resource. Our website, a great resource. And then just coming back to the health insurance piece, we do want you to have that health insurance card. You should know how to use it. You should know what your insurance is when you come to campus. Because remember, it's going to be a little more responsibility for students. They're going to be doing some of this remotely over the phone, and it's great if their family could walk them through it first. Thank you, and my contact information is here. Again, Dr. Anjali Vermani. I'm available at the health center through my email. My nurse, Carrie Hughes, is here for immunization questions at the health center, so feel free to reach out to us. We have the general health center account that you can reach us. Thank you so much.
Hey everybody, again, my name is Dr. Peter Forkner. I'm the director of the Counseling Center here at Bentley. And the Counseling Center, for those of you who don't know, is a place where we offer sort of mental health services. So we sort of want you to see us as your mental health resource on campus. Given the conditions of COVID-19, we've changed a lot, and as it says on this slide, we're going to be offering 100% remote telehealth services for the safety of students and staff. And while in these slides, I'm going to be actually using a lot of slides that I've used in previous years that sort of describe our services and sort of make notes as to where sort of there might be some adjustments based upon current conditions. But certainly one thing that is going to be consistent is that if you ever have a concern, if a student is concerned about their mental health or want to speak with somebody, the first point of contact is to call our main number, 781-891-2274. And there you'll be connected with our front desk who can sort of direct you. And this is a number that you could call if you're a student or if you're a parent and you're concerned or have some questions, or staff or faculty. So in our office, currently we have 5 licensed psychologists, including myself. We're currently in the process of hopefully hiring another psychologist to sort of meet the growing health needs, mental health needs of our student body. We also have 3 doctoral practicum students who are students who are obtaining their doctorates in clinical psychology at different universities outside of Bentley. And finally, we have one administrative assistant. So to get in a little bit more about what we do, we meet with all students who are experiencing any sort of level of mental health distress. We have made, as I mentioned before, we are shifting to remote services. So even though you will be calling our main number to make an appointment, that person at the front desk will direct you how to access your clinical appointment with one of our staff using our secure telehealth platform, doxy.me. And all the instructions will be sent to the student in that case. And what we're doing is generally we allow students to be able to make appointments when needed. And for the coming year, given sort of the conditions and given what's going on, we're hoping to offer same-day appointments for students who are struggling. And certainly, if a student was ever experiencing a mental health emergency, we want them to be seen right away. And we'll have staff available to meet with students in those cases. Now, go back to that. Sorry. So I want to make clear, though, that given sort of how we're structured, we offer, if appropriate, if it seems like we meet with a student who, upon our initial appointment, our consultation appointment, would benefit from some short-term individual treatment, that's something that we can provide. But I always like to point that out because there are many times that I'm contacted by parents or students who are wondering, would our staff be a good replacement for someone who has increased mental health needs or has long-term care needs? And I would say that it's something that you should probably discuss with your provider or the student's provider to see if a short-term model is really appropriate for what they are experiencing. So, and especially for those students who might be staying at home or coming to campus from far away, it's becoming increasingly easier to stay in touch with current providers. So I want to encourage that if you have a good relationship with your provider, that you might want to maintain that contact and see if that person offers telehealth appointments or telepsychiatry appointments. But we have a short-term program and groups. I'm sorry, go back one more time. So something I also want to point out, and that we're sort of, again, with this situation, we appreciate people's patience, but there are some logistical issues with regards to seeing students who are not coming to campus or not coming to Massachusetts specifically. Our psychologists are licensed in Massachusetts, which sort of dictates that they can only see students who are residing in this state for ongoing care. And so while in the course of this pandemic, there are many states, if not most or all states, have come up with certain temporary measures allowing clinical mental health staff to be able to see students outside of state, which is something that we hope to be able to provide for those students who are coming to Bentley and are staying at home out of state. However, I want to be upfront and clear that that these emergency measures which have been put in place, some of them are going to be expiring in 60 days, some are expiring in September. And so I just want to be upfront and clear that we're going to do the best we can to see students who are experiencing mental health problems, and we'll do what we can in the framework which we're allowed to, which we are certainly going to be allowed to see student for a consultation appointment and help them get connected with a referral off campus if that seems to be most appropriate. And that would go the same for psychiatry. So sometimes a question that I often get now is, what is an appropriate reason for my student or a student to come to see someone in our office? And it really varies. So we certainly have those students who are having trouble adjusting and stress and anxiety, depression. But really we see the gamut of mental health needs. And certainly given the current COVID-related conditions that might be coming up, we're expecting to see students who are experiencing more increased loneliness and sadness, and maybe having experienced a little bit of grief based upon what situations might be going home, or grieving sort of the loss of their college experience. So we want to sort of leave the door open for different ways that people might be experiencing that, and certainly we'll be able to see them for that consultation appointment, and if it seems appropriate for us to continue seeing them, that's something we'll do. If it feels more appropriate to refer them to another office or off campus, we can help with that. Something important to point out is that services at the counseling center are part of the cost of attendance. So no need to bring your insurance card. We're not going to be billing insurance. There's no additional fee or anything like that. It's part of the cost of attendance. Also, as Dr. Vermani pointed out earlier, our services are completely confidential. So we will not be able to release any information that a student has told us, or even that they've attended an appointment with us, without their permission, explicit written permission. So even if a parent calls and says, oh, I know my son was just in your office or was just attending an online appointment, unfortunately, if we haven't received permission from that student to acknowledge that, then that's something we wouldn't do. But that's because we take confidentiality extremely seriously, and we want students to feel safe that whatever they share with us is not going to be shared. And it's a medical record, so it won't be part of a university record. It's not going to be held by part of the academic institution. It's held in a secure electronic medical record. So we're open 8:30 to 4:30 p.m. As I mentioned, call the front desk to make an appointment. But we also want to point out that that sometimes mental health needs occur outside of regular business hours. And so if this should occur, if you're stressed out and you need to talk to somebody or anxious, we do have after hours care. And so you can just call the main number and there will be a prompt that you can push to get connected with them. And certainly if it's an emergency, call University Police. They'll be able to help you out.
Thank you, Peter, and hello again, everyone. My name is Jessica Greer-Traua. I'm the Director of Wellness and Prevention at Bentley, and my office suite is co-located with the Counseling Center on the second floor of the Callahan building, so we're just above University Police. Like many of our colleagues, we have had to adjust our programming and our services to deal with the current pandemic. So I'll go over in the next few slides what we will be offering this coming semester or trimester. So a little bit about my office. We are the health promotion team. So we do a lot of work using public health frameworks to provide programs and services to improve our student well-being. We have a really strong focus on prevention. We use data to inform our work, and we like to focus on the areas that our Bentley students say get in the way of their academic success. Most commonly, they fall under 4 buckets. Things like stress, time management, sleep is a really big thing that our students report, low quality sleep and trouble sleeping, substance use concerns, as well as relationships. So we, in addition to a lot of the health promotion programming and outreach that we do on campus, my office also offers individual short-term services. And this includes individual health coaching. So let's say a student, for example, again, is struggling with something like sleep. They could come and meet with my staff and we can talk about what's going on with their sleep and identify some strategies and ways that a student can improve their quality sleep. We also provide consultations on alcohol, marijuana, vaping, and other substance use, specifically for students who are concerned about their use or looking to cut back on their use. And then we also do specific cessation services. So due to current pandemic, we, like our colleagues in the other areas, are going to be offering these direct services via the secure telehealth platform Doxy.me. A lot of what we do also has to do with outreach and being visible on campus and being ambassadors for health and well-being on campus. And so we've done a lot of, we've put a lot of thought into what it is we're able to offer our students given current gathering size restrictions and, also making sure that we're offering equitable programs for our students who are choosing to learn remotely this coming trimester. So I want to point out that we have 2 very high-functioning peer education teams, and these are groups of students who are really passionate about health and well-being topics. So we have the wellness educators who focus more on those health topics, and we also have the RSVPs, which are the relationship and sexual violence prevention educators. And both of those groups are going to be operating remotely and offering programs for students to participate in. We also are going to be rolling out a brand new bystander education leadership training program. And this is a training that basically empowers students on how to look out for each other and intervening on behalf of their peers. It's a program that we've run similar programs to this in the past. We're really excited about this brand new curriculum. So we're going to be rolling that out to campus this fall. And we're also going to be looking for students who want to serve as facilitators for that program. One of my colleagues in Counseling Center and I are working on a positive psychology series called Good Vibes, and it focuses on how do we improve our mental well-being, and it's rooted in a lot of the science that's connected with boosting mood and happiness. So we are going to be running a 7 to 8 week kind of challenge, and that will be launched very quickly in the beginning of the trimester. My area is also known for mindfulness and meditation classes, so we are planning a 4-week skills-based class in October, and we work closely with our colleagues in Spiritual Life to offer weekly Zen Zooms, and my colleagues in the Counseling Center have adapted some mindfulness and meditation scripts into YouTube videos, and that's accessible via our website. Finally, we're going to be offering workshops on sleep and radical self-care, and very proud to be rolling out a brand new program this semester that gets at small group dialogue and building social connections. I know a lot of students have concern about what's going to happen, how am I going to meet people, how am I going to build these meaningful relationships on campus when gathering sizes might be restricted, or some of these larger scale events that are meant to build community are going to be adapted in different ways. And Project Connect is a way that builds really strong connections and relationships among small groups of peers. So please be on the lookout for that. I also want to point out that I know that since pandemic has kind of affected a lot of the places where we reside, people have really felt like there have been some restrictions. But Bentley is located in a really great setting. There's a lot in the surrounding Waltham community, and there's a lot on our campus that is going to be thriving even during these current restrictions. So I just want to remind everybody who's listening in today that the weather is going to be beautiful when you arrive on campus. So please make sure that you're studying and gathering with peers outside and maintaining those safe distances. I know that our student leaders for our 100+ student organizations are working really hard to make sure that those clubs are all operating, and our student programs and engagement staff are working alongside with them to make sure that those clubs can still thrive. We also are going to be offering those small group experiences like Project Connect or intergroup dialogue. And then I want to point out that right across the street from campus, there is a network of hiking trails for students as part of the Robert Treat Payne Estate. And Moody Street in downtown Waltham is essentially closed off 4 to 5 blocks for every single restaurant on those roads to have on those blocks to have outdoor dining. So there's a lot of great opportunities for you to head off campus and hang out with friends in a safe space. And finally, there is a canoeing, stand-up paddleboard, kayak rental spot also located right on Moody Street. It's another really fun outdoor activity to try with friends. So normally, when our students are transitioning to college, we have to think about some of these major life changes and these adjustment issues. And I just want to remind you that wherever you're choosing to learn this coming trimester, your first semester on a campus or part of a campus community, there's always going to be ups and downs. And for those of you who are joining us and living in the residence halls, regardless if you live 2 miles away or 2,000 miles away, there might be times where you're feeling homesick, or there could be times that you're feeling lonely, and that is completely normal. So please don't feel any further isolation. If you're experiencing any of those concerns, reach out to a peer, reach out to us, we're here to help you. I also want to suggest that you be realistic with your expectations for success and expect setbacks. This is the time in your life where you might experience failure or you might mess up. And that's the best thing about a college environment, is it's a safe space for you to do that. So please be realistic and make sure that you use these as growing and learning opportunities. You've probably heard this before, But as you engage in lots of different social media channels, it's really important to recognize that what you're seeing presented online is not necessarily reflective of what a person is actually experiencing. So really, please be careful to not compare your experiences to what somebody is curating and presenting online. I also want to point out that it's important to set boundaries for your time. Develop a really great sleep routine, and if you need help with that, don't hesitate to reach out with us. Get outside as much as you can and make good choices. Fuel your body well, choose well to feel well. We have a wealth of resources online for our students. So if you are looking to explore health topics or want to get more involved in our areas, if you head to the resources page on our website, you can be connected with a lot of apps, websites. We have a lot of videos. As I mentioned before, our counseling center has a YouTube channel. We also offer live online workshops. Our Instagram is also very vibrant. So if you head over to Bentley_health on Instagram, you'll be able to see a lot of different health promotion content. You'll be able to see a lot of the advertisements for upcoming programs and events, because that's the primary place where we do promote this information. And then finally, I just want to remind everybody about some of those requirements that you might have seen in your new student checklist. For my area, you would have noted that there's some required online prevention courses. We originally had indicated that those courses were going to launch sometime in late July, early August, but we received word from the company that produces those courses that they need us to delay until mid-August. So we will actually be rolling those courses out as part of your new student orientation program, and we will share information with you at a later date about it. Just know that you're going to get your login information, so if you're worried that you haven't received it yet, it hasn't gone out yet. And then finally, just to recap before we get into questions, as Dr. Vamani mentioned earlier, if you're looking for the most current information regarding pandemic and COVID-19, please visit the Back to Bentley website. Here is our contact information and also the contact information for one of our partners within Student Affairs, which is the CARE team. And it's another resource. All of us are available to help you and consult with you about your students.
All right, thank you all so much for presenting. I know that was a lot of content, and while you all are such wonderful colleagues, I feel like I always learn something new from being a part of these live chats, so thank you so much. What we're going to do now is take a look at our Q&A and go ahead and answer some of those questions that you have. So let's start here. Okay, so there's one question about allergy specific. So, Anjali, would you help me with this question here?
Sure.
One of the people who are reaching out are saying that their student has some allergies. Could you talk about how the school handles allergies specifically related to food and dining?
Sure. Feel free to reach out to us. We have a nutritionist who works with our dining services. So Dexo is the name of that company, and they have a nutritionist who will design an entire program for your student that is based on their needs. And they also have set up within the cafeteria a place where, allergy-free foods are prepared. So if you email the health center account, the ga@healthcenter@bentley.edu, we can connect you with that Sodexo information. Alternatively, if you want to look on the website regarding dining, there may be a link directly to Sodexo's nutritionist.
Okay. The next question is about information on the health portal. If someone has not submitted all of their information, are they still able to do so?
So the health portal is active and live right now, although the requirements were officially due July 1st. There's a lot of uncertainty this year, and it's understandable. So please continue to get that information in. And people are asking me, if I'm not going to be on campus, if I'm going to be out of state, should I do this? And what we would like to do is welcome you back to campus, hopefully in the winter. And so go ahead and do your requirements now. Now is a good time to finish this work. Also taking care of any missing immunizations, any gaps, getting questions answered. So continue to do so now, and please actually do it now. Don't wait until August 30th, which is something I saw in the questions. Do it now such that when you arrive on campus, it's already done, because in this environment, things are a little bit more challenging to take care of.
There are a few questions about quarantine, and I know that there will be some specific guidance sent out to students later this week, but is there anything in particular that you might be able to provide in regards to how long a student may need to quarantine? I know that you provided a few options. Could you please repeat those?
Sure. So there's two different kinds of quarantine we're referring to, right? So there's the travel recommendations, or actually requirements in Massachusetts on people entering Massachusetts. And then there's the quarantine for those people who are exposed contacts who then need to quarantine due to exposure to an illness. Those are two different things. The quarantine for those people who are travelers, they should follow the Massachusetts Department of Health requirements, which we will issue some recommendations on how that should be followed. And certainly you can look online now or wait for that email. Those requirements are going to offer the option for you to do a test in your home state 72 hours before you travel to Massachusetts. And then you would quarantine until that test came back negative. Or you could do a test upon arrival. Now, we will test on arrival, but you will be put into quarantine and not freely able to move about until that test comes back. If you do the test ahead of time, you have your results ahead of time, then you will not be quarantined upon arrival. You'll actually be much more free to move around, take care of move-in opportunities, and then just fall into the queue of doing the weekly testing, including testing on arrival. So those are different options. Separate from that is a quarantine for students who are exposed. So if you are in that realm, and that hopefully will be further down the road, if you are a residential student living in a dormitory, there will be dormitory quarantine offered to you. If you live off campus and you live in an apartment, you should consider making your own arrangements for quarantine, because we wouldn't be able to bring back potentially exposed students to campus, therefore exposing our campus to illness. So there are two different things. I hope that helps understand the difference.
So Anjali, I'm going to take over moderating while we're working on the mic issues. Somebody had asked a question specific about lab tests. Can you go back and review and clarify, what tests would be covered by students' insurance or billed to students' insurance? And does that also cover the weekly surveillance testing that will be happening on our campus, or any diagnostic testing for COVID?
Sure, of course. So the screening testing program is a Bentley program, and Bentley will pay the cost of that screening program. There's a separate option, if necessary, a diagnostic test for COVID for a sick student. That is covered by insurance. So during the initial phases of the pandemic, insurance companies all agreed to cover the cost of diagnostic testing for students. Separate from that is the same swab test, but you're a traveler. Now, travel health has never been covered by insurance. If you travel to, let's say, a safari, you might require certain vaccinations. Those are not covered by your insurance. This is similar to that. If you were to get a COVID test, it's possible that you may have to pay for that travel-related diagnostic test, okay? So I hope that helps as well. But certainly anyone who's sick who needs a test, that is covered by your insurance. Or check your insurance to make sure it is, but Massachusetts policies do cover it.
So I'll give you a break. I saw a couple questions come in from folks asking about, how often a student could leave campus, or will visitors be allowed? I will say that the residence life staff, will be posting information specific to, visitor policies. So I would check the Back to Bentley website and the housing addendum that you all signed. In terms of how often students can leave campus, students can leave campus, if they choose. I think I would just, I would just recommend that you assess risk, right? Like, are you leaving campus for work? Are you leaving campus to gather at a party with, 20 to 50 people off campus? One is going to be a much more riskier situation than the other. And so, if you're making choices to leave campus and you're going into risky situations with a lot of people in in close contact, just know that you're taking that risk on yourself of, potentially becoming ill or, also infecting other people on campus. And so you have to think about your choices, not only in the individual level, but also at our community level. And we all need to be practicing these precautions in order for our community to open safely and also remain open safely.
And I would like to
sorry.
add to that, Jessica, just thinking back, and I just want to reemphasize sort of these 4 public health pillars that they're talking about in Massachusetts and other states. And you still want to follow those if you move off campus. So those include the face coverings, which are required. So we will be requiring them on campus for all students, faculty, staff. It's a universal recommendation. Why? It's been shown to be effective. Whether there's controversy or not about it, it is shown to be effective. The other piece is the hand hygiene. That's because you're going to touch surfaces, and that's just a good practice. The other is 6 feet of distance. That, again, has been shown to be effective. And finally, not going out when you're sick, avoiding large groups. Those have all been really shown to have made a difference. When we were in our flatten the curve phase, that was why we flattened the curve. And we'd love to get back there again.
Sure. So we have a question specific about insurance and international students. So while we know that Massachusetts, would require international students to purchase the program that's sponsored by campus, if a student is choosing to learn remotely this trimester, do they need to purchase that insurance?
So there's a special process this year to accommodate that issue. And then what it will show on the University Health Plan's website is this waiver that you can fill out, and University Health Plans will verify that you are out of the country and you do not require insurance for this particular semester. So yeah, you will not have to have that, but please keep it in mind. Again, we're hoping to welcome you back in the winter.
I'm just scrolling through the questions. Give me a moment. We have a few more questions, I think, regarding just the quarantine guidance that's evolving from the state of Massachusetts. Do you know if Massachusetts is requiring a specific test? So like if somebody, does get a test prior to driving, to campus, is there a specific test that will be accepted by the state, whereas other state Department of Public Health or countries' public health divisions might have different requirements?
So the requirements will be spelled out on the website. So I don't want to say exactly what test it will be. So it would be a diagnostic test. Okay, so it would not be the antibody test for immunity. It's most likely the PCR test, but potentially Massachusetts might accept the antigen test, which is the rapid test, but that's not been shown to be as accurate. So we want to go for the PCR test if possible, if you are looking to schedule this. So that's what they're going to recommend. Again, public health guidance is shifting so rapidly. And also keep in mind, there's some states where you don't need to have that done because you're coming from, a state where they have the pandemic under control. That includes a lot of our neighboring states and mid-Atlantic states. So do check the website to see you may not require this, or something could change, and certainly you may need to do it. So a lot is evolving. That Back to Bentley website is really a great resource, but sometimes when it comes to public health, you may want to become a little bit familiar with the public health websites as well.
Another health insurance related question in terms of the waiver process. Can you just share the website? Because we had a question about, who can waive the insurance. Do you know the exact website that students can visit? Is it just the University Health Plan's website for that information?
Yes. So if you want to scroll back in the slides to those resources for the health, it's not going to be the general resource one, but the health center resources, or certainly on our website. If you go to health center website and then you go to University Health Plans, which will be linked to our website, you will get that information. So hopefully that's easy to find. I check the University Health Plans website regularly, And, they are a particularly wonderful partner to us. They've been great with answering questions. So certainly do feel to reach out to them and they will help you.
Do you know, we have a question just regarding Bentley dining again and management for allergens specific for peanut allergy. Do you know the contact over in Bentley dining that we could share with a student who has a specific question about peanut allergy? I can just type it in or we can type it in the answer.
They could feel free to email me and then I'd be able to link it to them because I would have to look it up. I don't have it on the resource list right here. But certainly we can get that to you. And, again, BL is a great resource, but we don't want to overwhelm her. So feel free to email either the GA Health Center account or avirmani, AVIRMANI at bentley.edu, and we will get you that link for any type of allergy concern.
Okay. Question about student athletes. Specifically, I guess, if you could explain how how we work with how we work with athletics, how we work with the trainers, and how we work with the physician down there.
Right, so we work with all of the campus partners really closely. Again, athletics is going to look really different. So I think we have to work with them, and it really depends on what's going to end up happening on campus. If it's practices and the trainers need to reach out to us because there was some sort of injury, then we can easily make arrangements to communicate with students. What we typically are seeing are students who've had injuries, whether it be related to practice in either a varsity sport, a club sport, or intramural sport, or maybe a head injury, a concussion. So that's what we typically see. What kind of arrangements we're going to make this year, again, we're going to be adaptable and, work with whatever athletics needs us to do for them. So we are very regularly in communication with athletic trainers.
I just want to acknowledge that there were a few questions specific to move-in and, who can help with move-in and what that process will be like. And for those of you who had questions specific to move-in, if you could email those to housing@bentley.edu, that's the department that would best be prepared to answer those questions. I know that further correspondence is coming out regarding those processes very soon, but if you'd like to get that information sooner, you can email housing@bentley.edu. I'm just scrolling through and seeing if there's
I just want to add one thing about an academic question that I also saw. So feel free to, email the academic affairs office as well. So anything regarding classroom or courses, while I'm letting you know remote learning is available, certainly the faculty is going to be the one to answer questions, and academic affairs will help you with any remote learning questions that you may have. And they are also a wonderful partner to us, and they're regularly in communication with us as well.
Yeah, can you go back? We had an inquiry about vaccines. Would you be able to scroll back to the slide that listed the required and recommended vaccines, just so for the person who had asked that question, this is the list. And it's also listed on our website. So these are the vaccines. These are the vaccines. Anjani, if you could go over them again.
Of course. So these are also on the portal, and they'll be explained step by step on the portal. Should you have any questions, if you have more detailed questions, you can ask Carrie Hughes, our vaccine nurse, as well. So the first one is measles, mumps, rubella. That's really important. Measles used to be a very important infection of concern. It still is. So we really want to make sure you have that measles, mumps, rubella. The Tdap for tetanus and pertussis and diphtheria protection. We do a booster every 10 years. Hepatitis B is a liver, viral infection that we can prevent with this vaccine. The meningococcal, which I talked about, it's a bacterial that affects the brain. Again, we don't want that one. And then varicella is chickenpox. So that could either be a history of having chickenpox or having the vaccine. And tuberculosis screening, you look at where you've lived and traveled. If you've ever lived or traveled in an area that has a lot of tuberculosis, then you potentially may need a tuberculosis test with your primary care physician. and they can assist you with that. It's commonly done for students who live outside the United States in multiple different countries. Again, the recommended ones are listed below. Those are just because as a young adult, you want to have the option to take these vaccines. These are really great vaccines to know about, and certainly over time, we may be able to make those available to you. But right now, things are a little bit more restricted.
So I'm not sure if you can answer this question yet, but a few came in recently about family members and caregivers, and if they would be required to be tested for COVID in order to help their child move in. Do you know if that's something that the state is going to be requiring?
So I think the state is reviewing that because we really do want to give families information about that. I think if there's uncertainty, it's safer on the side of the family to go ahead and get the test at the same time as the student, because there may be a necessary time where you're staying overnight, where you're, moving through Boston. So we'd like to be safer and have the whole family have that test availability. It's certainly more crucial for the student because of kind of a movement requirement, but I think it would be safer for the families to go ahead and get tested. Again, that could change in the next month, and please just keep up to date with that guidance because it is evolving so quickly that this guidance literally came out, 3 days ago.
And then I recognize we're running short on time. If somebody has already submitted their information to the portal, can they go back into the portal and edit it or add other vaccines if they got some of the recommended vaccines since submitting that information?
I think if there's something that they want to add in that was missing, they can go in and add that. But if you need to adjust the date or something, you might need to speak with Carrie Hughes and just verify that you've done that because you think there was some sort of mistake. If Carrie has directed you to do that, then feel free to go ahead and do that because she is in communication with many students on a regular basis.
And then for students who haven't had TB screening, can that be done? So let's say it's an out-of-state student or a student who is an international student traveling to Massachusetts. Can they have that TB screening done once they arrive in Massachusetts? And then is that something that we would be referring to our partner pharmacy or something that would be coordinated within the health center?
Exactly. So you should try to get that done in your home country because, again, anything you can get done at home where you're more familiar with your environment, you know what healthcare is available during the pandemic, I think it's going to be easier in terms of stress. That said, we will have that, partnership with the pharmacies where there is a blood test that can be done for the particular students where that's recommended, and that can be done once you've moved into campus. But again, then you'd have to get yourself there. So we'd love for you to take care of it ahead of time just to keep your life less stressful.
Perfect. Okay, so it looks like we've run out of time. Not sure if Bobby Lynn's microphone issues have been resolved or not, but just want to thank everybody for taking the time and joining us as we provided these updates and information on our offices and services. Please reach out to us if you have any further questions or if there's any way that we could assist you and or your students once you join our campus in the fall. We're really looking forward to having you join the Bentley community, and we hope you have a good night.